Neurocognitive disorders are a common issue impacting those living with HIV. Effective antiretroviral treatment has lessened the severity but not the frequency of these impairments, with about 30% of patients living with HIV experiencing cognitive issues due at least in part to HIV factors. This is known as HIV-associated neurocognitive disorder, or HAND. HAND refers to a spectrum of impairments which range in severity to include asymptomatic neurocognitive impairment, mild neurocognitive disorder, and most severely but thankfully rarely seen HIV-associated dementia. While HAND is often of a mild degree clinically, it greatly impacts a person's quality of life and leads to higher levels of unemployment, lower medication adherence, it increases levels of social isolation, and is associated with higher mortality rate. Neurocognitive impairment is becoming an increasingly important health condition in the context of an aging HIV population. Across healthcare settings, quality of life is now considered an important and prominent patient-reported outcome in clinical care and intervention efficacy, and can be viewed as both a predictor and mediator of successful aging. In fact, there have been calls to include good quality of life as a fourth 90 in the 90-90-90 testing and treatment targets introduced by the World Health Organization in 2016. Despite this, there is a significant lack of knowledge and tools relating to quality of life in patients living with HIV and cognitive impairment. While a few qualitative studies exist examining the lived experience of having HAND, no studies have directly explored quality of life, and there are no assessment tools dedicated to exploring or examining quality of life in this population. With this in mind, the aim of this project is to address this gap, exploring some of the lived experiences of having HAND, understanding how this impacts quality of life, and developing a framework or conceptual model for understanding and guiding future research. First, we will conduct a scoping review. This is a type of narrative synthesis similar to a literature review, except it is informed by an a priori protocol and systematic approach. It's really useful when a body of literature has not been comprehensively reviewed, or it exhibits a large, complex, or heterogeneous nature not amenable to a more precise systematic review. Secondly, we will conduct qualitative interviews with people attending HIV services in Brighton and London who are diagnosed with HAND. We aim to recruit 25 to 35 people and ask them about their experiences of living with HIV and HAND and how these two diseases impact their quality of life. We will then analyse the data using a thematic analysis. Using the information gained from both the scoping review and the qualitative interviews, a conceptual framework for quality of life will be developed collaboratively. Conceptual frameworks are really helpful and work as a roadmap or skeleton for guiding research. They allow for the identification of relationships between variables and help to inform tool and intervention development. It's anticipated that in exploring the experiences and identifying the components influencing quality of life and how they relate to one another, we will gain an understanding of quality of life in patients living with HIV who have HAND, which will inform the development of patient-reported outcome tools and assist with the development of interventions which have a real-world and meaningful benefit for our patients.